Hi, my name is Georgina Leelodharry. I'm Head of Operations here at the Institute of Osteopathy. Following the issue of Morris's COVID-19 update last week, I wanted to take this opportunity to speak to you directly to provide some support and reassurance to you, our members, and to address some of the common questions that we are receiving about the practicalities of running your clinic in the current situation we find ourselves in. Firstly, I wanted to reassure you that we are keeping an extremely close eye on what is a very fast evolving situation, and we will attempt to provide you the advice that's most up to date as soon as the government releases it. Now, while the number of confirmed cases remains very low in the UK as a proportion of the population, we all need to take sensible measures to slow the spread of the virus. And as healthcare professionals, you may need to consider adapting your usual practice at this time. One suggestion is to introduce or to increase telephone contact for follow-up with your patients, particularly those that are most vulnerable. Any consultations, including these by telephone, are still chargeable at your normal fees, as these are charges for your time as a healthcare professional. We will be issuing a best practice guide on this within the next few days. For those of you insured by the IO, you can be confident that your insurance policy will cover you for both telephone and private video call consultations. However, I would remind you that you should treat these consultations in exactly the same way as an in-clinic one by recording all the interaction, all the questioning, all the advice given, including your clinical reasoning, in your patient's records as you would do normally. Now, we have heard from members that the potential loss of earnings is a concern for many of you, and this is something that we can completely understand. Last week, the government announced additional provision for small businesses, and there is a suggestion that they will be announcing further information later today. As soon as this information is released, we will disseminate this through our social media platforms as well as our website. We know that they have introduced the business interruption loan scheme and also a review of business rates for all of those small businesses with less than 250 employees. If you employ staff, there is also help available from the government to pay statutory sick pay. For those of you who are self-employed but don't have income protection policies in place, or indeed your current policy is not paying out at this current time, while we understand you cannot claim statutory sick pay, there may be support available through the Universal Credit or the Employment and Support Allowance, providing you meet the relevant criteria. The situation is moving very rapidly, and there are many questions for which we cannot yet know the answer. However, I wanted to reassure you that at the IO we will continue to keep you updated via email, social media and our website, on which you will find some useful links to relevant advice. If you want a clinical perspective, I would encourage you to watch the video recorded by my colleague Matthew Rogers, who has shared some insights for you to consider. In the meantime, I would encourage you to continue to use your professional judgment to assess a rational approach to managing your business practice within the unique circumstance that we now find ourselves. If you have any questions at all, please do not hesitate to contact us here at the office. Thank you very much.